Hi, everyone. I'd like to do a shout out to our sponsor, Bako Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bako Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Bako Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Bako Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bako Diagnostics services, get started today by sending an email to corporaterations@bakoddiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and co-host for the Dean's Chat podcast. Once again, I'm joined by Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing great. Here we are, another Monday. How was the PI meeting this weekend?
Oh, it was excellent. You know, it's always fun to meet a bunch of new people and kind of nerd out on fracture mechanics or new technologies that are coming out. And it was an outstanding meeting.
Very good. And PI is short for Podiatry Institute, of course. For our listeners.
And I know you just got back from the Southwest.
I was at the Symposium on Advanced Wound Care. Yeah, I did a little workshop there and got to connect with lots of friends. So this is a busy time of the year usually for conferences.
It is.
Well, hey, we have a phenomenal guest today. I'd like to welcome Dr. Nicole Brouyette to Dean's Chat. Dr. Brouyette, welcome.
Hi, thank you so much for the invite. And it's really a pleasure to sit down with you both.
Thank you. Thank you for carving out the time. I know there's a 3-hour difference between Michigan and Arizona. So we're the only thing between you and probably dinner tonight or something.
Exactly.
Kids' activities.
All right. Well, also, we are fairly informal on Dean's Chat. Are you okay with us going first names? Nicole, Joe, and Jeff?
Absolutely.
Fantastic.
Well, thank you again, Nicole. You know, you and I first met at some of these big academic things through the AO almost a year ago now. And ever since we had the chance to kind of connect, I have been so excited about the work that you're doing, and we're really excited to have you on the show. I'm going to kind of do a brief intro, and then we'll kind of go through some of the really fun things in your career as we go through the interview. So we'll start with, you're currently the Associate Program Director for Henry Ford Health Systems in Detroit. We're going to be really excited to hear about the residency program and all of the things that go with that. But you first started with your undergraduate degree from Wayne State University with a Bachelors of Science in Molecular Biology. And then you completed your podiatric medical school with the Ohio College of Podiatric Medicine and completed your 3-year surgical residency training program with St. John's Hospital and Medical Center in Detroit. So I'd love to start with being the Associate Program Director for a wonderful residency program. Can you talk a little bit about the structure of your program, what the kind of each year looks like, how many residents you take, and what it might look like for an extern to come to your program?
Yes, I would love to. So this is a new endeavor for me. I was approached to sort of take over an existing program at Henry Ford Wyandotte. And then in the time that's taken place, we've actually had a merger, and Henry Ford Macomb, which was our North program, and the Wyandotte program have now really combined into one. So they were looking for basically new leadership, and Paul DeLito took over program director, and we all sort of interviewed, and I took the role of APD for them. So it's been really exciting. It's been a lot of new learning experiences for me, I was always core faculty with different residency programs in Michigan area, but taking this new leadership role on, and then what it entailed. So we have 10 residents that come in. We did have more just because you had a merger of 4 from one program, 3 from another coming in, and we've graduated now our first class last year, and then we're going on our second class this year with the new leadership. I do a lot of the research. I'm also like the research coordinator for the program. And then I also do the didactic overview. So we sort of split our roles, which has made life a little bit easier when you're taking on such big new roles. And so I really tried to elevate this program and get it more on the map. So like getting publications out, going to ACFAS, making sure that, adding to this curriculum where you have to do research in order to graduate, and then what that looks like, how to submit to the IRB, what does that process look like? And then I've also included just recently in the past year to do like a monthly grand rounds where it's more like an M&M with our own program. But then I have a guest speaker where I thought, after COVID, the silver lining was everyone went virtual. And so I've really used that to my advantage and said, like, why don't we take great speakers, which sort of what you guys are doing with the podcast, you can tap into someone from all over the North America and have different people come in and speak to our program. And I really ask the residents, like, this is my big thing. I take feedback and turn it into something positive. So I say, what does this program lack? What can we make better? Trying every year to like add something on so that they're getting out of it what they want. And then also, and in turn brings in good candidates to our program and sort of highlights our program. And so one of the things that I had just recently heard is, they would like to have more guest speakers. They really like that part of it. They want to know about more fellowships. And the best thing is I can bring in these fellowship directors now, and they can give us a few cases and then tell us what fellowship's really about. And I'm trying to push these residents to do whatever they really want to. If they want to go more into the wound care, they have that opportunity at our program. If they want to go to fellowship, we like to use our connections and our networks to sort of bridge that and push them towards their goals and help them get there. So it's been like very exciting because this year we have 2 residents going to fellowship, and I obviously really truly do encourage that. And it's nice to see like how it's grown and where it's going. So for any intern that would like to come visit our program, we do some core rotations. We try to get the students involved as much as possible, hands-on learning. That's the best way to kind of submerge. You've already done the textbook. And we really are open to, we want you to succeed. We're not there to like really pimp you. We want you to grow. We ask you a question. It's just for your own personal growth. And I think that's really shined through in the last year.
I love that. And, it's been really fun to watch the culture in residency programs adjust and evolve to your point where we're not just asking you questions to torture you, which when you and I went through, and I'm a little older than you are, sometimes that was very much the intent, right? Like, oh, we're going to put this student on the spot because we want to see how they act under pressure. And it does feel like there's been a genuine refreshment in the approach to academics in these, high-powered residency programs that we want to encourage students to learn, and how they learn best is going to be on them. So can we create an environment to spark curiosity? So I appreciate that you pointed that out.
Yeah, definitely. I would say the culture has changed for the better. Mental health is always taken into account. We want residents to want to come to us, and we're not trying to intimidate you. I don't need to belittle you to make you feel, a certain way. I want to encourage them so that they are so interested and so intrigued that they want to come back or be like, yeah, Dr. Brouyette taught me that. That was a question that I remember she teaching me in the OR, and I'm not going to get that wrong again. Those are the types of like life experiences. Like we all remember an attending saying something, even we were all students, that has stuck with us. And so like, that's really one of my other little goals.
Yeah. Jeff, what are your thoughts?
Well, I think it's great that 2 programs came together in a community. How many attendings do you have? And what is the lay of the land for a resident in terms of second year, third year, getting priority for cases and things like that?
Yeah, so we like to build on cases on level and comfortability. We're not pushing, a first year into like any great trauma case, and we try to build each year on them. we are a medical group. We're all core faculty through a hospital. So, the other thing is, we're not like, these aren't paid positions, but we want, our culture is you give back, and then, basically, if you're going to join our hospital, you're going to teach. We're in an academic institution. So I think that goes a long way. Having faculty that do want to come, they joined our practice to teach. So that's a great highlight. And there are 10 core faculty. And we have a few faculty that are private practice, but then we do cover private practice sectors at our hospital. So some of our hospitals are core faculty and medical group only. And then we have multiple satellites around Michigan that we cover, where you're going to get like the private practice experience. So residents, of course, in intern, you're doing your core. But anytime we can get them in the OR, or they have a day where they're free and they want to double scrub, I'm all about like osmosis of learning. So if a second year can teach a first year and a third year could teach a second year, then, I feel like we've really sort of done our job. Because if you can relay that information, and that means you really do know it. And I've really always honed on that. So if I can get them to start teaching each other, it's a really big positive. And I know that they're really ready for the real world.
True. And you're also setting them up for the next generation of educators if you've got that environment.
Yeah. And that goes to the point I sort of talked to you guys, Dr. Stuart Wertheimer, one of his big things was giving back, being a teacher, getting into some sort of leadership role, and then giving back to your profession. And so I'm trying, as one of my old mentors, to do all of those things. And I think, I'm well on my way. And one of my biggest passions is teaching, and getting this job was honestly a huge success and a big milestone in my career.
And that's a beautiful segue to some of the other leadership things that you are involved with. You've been the chairperson for the Paragon28 Women in Podiatry Surgery Summit. Can you talk a little bit about that program, how it started, and what it really means for the profession?
Sure. So when I was a resident, I didn't really have that. Like, I had a mentor, but I really didn't have female mentors. And it really wasn't because no one wanted to mentor me. It was just lack of women in medicine. And so I, kind of took this upon myself to kind of think like, wouldn't it be so nice if some of those barriers that I felt like I had to kind of bust my way through, if I could somewhat lift some of those for some people and encourage more of a community sense, and maybe create like a safe place for women to, talk about work-life balance and community, and of course, surgery, and having a mentor to help guide you. And so I approached Paragon28 with my idea, and the CEO at the time, he was like all on board for it, which, you need a backing of someone to really, really encourage something and take this on, because it was just a vision, right? So I took I put feelers out and wanted to see if people in Michigan would like to join, like some of the female docs that I knew, and even a few of our residents at the time. This is when I was with a different program. And you know what? Like, all 17 people I invited said, yes, let's go. So we flew to Denver. We started this course. I really didn't know what I was getting into. They're like, all right, get up. You can get up and start lecturing, So I had to come up with like a course design and a flow. And, then again, I always took feedback, did a survey. What did they like? What didn't they like? And then over the past 5 years, we've grown it nationally. And we've developed a course and a summit where it's just a good sense of community. There's connection. We bring in guest speakers and keynote speakers that are like other physicians and other specialties who are great motivational speakers. And they talk about obstacles that we face and how to break boundaries. And I always feel like so exhilarated after we leave this course. Number one, I meet so many people. I just say like, make one ripple, make one connection, and you'll grow your network. But like, hopefully that we all will be like friends and colleagues for, the rest of our careers, and you have like a network of people to fall back on. And so that's really what it's about. And I feel like if I can do my job to break some of those barriers, talk about the struggles, things that people don't want to talk about in a safe, intimate environment, I think that is what really has attracted more and more people. And, every year we get about 75 people now all across America who will sign up, and the course sells out and there's a waiting list. And so I try to again, take feedback and make it as and modify. And sometimes we bring in different speakers, and it's really, really been one of the things in my career that I am most proud of doing. And I just, have people that I've met over the past even 6 years who still reach out and just like, thank you for doing that. And I love that I'm not alone in that sentiment, and that you just openly came out and talked about it, up on stage. And so it's a really good mix of education, community, foundation, and then allowing people just to speak freely, and that's what makes it so great.
I can absolutely mirror so much of that. It's important to see someone doing the things that you want to do when you're young and impressionable. And it doesn't mean that they have to be exactly like you, but when you do have someone that you can connect with that understands things through a lens that you live through, there is something important and valuable there. And I love what you had said, and I'm not going to get it exactly right, but something along the lines of wanting to create a space for that. Yeah. Can you talk a little bit about what you think some of the barrier, or what you have seen and heard people talk about, are barriers that are a little bit different when it comes to men versus women in surgery?
Sure. Well, women, we sometimes have limiting beliefs, right? Where, we just think that we can't do it, or maybe we're not good enough. And we have some of that white coat syndrome that we speak about, and the burnout, how to navigate some of those things, and like what real life experiences like that, some of the panelists and some of the faculty. And the best part is like, they're not just asking us, like the entire audience is in on it. We all have our own microphones, where you're sitting, and like, I might give something, and then the person in the audience is like, wait, I can add to that. I did this instead, and try changing this up. One of the biggest ones is like work-life balance. Like, how do we do this as women who have full-time careers and then balance the family life? Or, what are we doing to talk to if you're in some sort of corporate medicine, like how do you negotiate your career, how you see you want it, and still sort of get it shaped? And it's okay that it doesn't look like maybe your colleagues, right? Yeah. And we talk about RVUs, or we talk about contract negotiation. There's so many topics that come up. My favorite one is our last keynote speaker was Dr. Sasha Shilkalt. And if you've ever read any of her books, she does a great CME course for women in medicine. And she came and talked about setting boundaries. And that was like, to this day, the people that have come are like, I set a new boundary. I learned something from that course, and it was this and this and that. And the boundary setting is really so crucial, and it's hard to do, and it's hard to say no, because we always say like, take it all on, but then that leads to burnout. So some of like the key things we learned in the past like 2 years at this course, I still implement today. Like, I am not going to check my emails after 6 o'clock. Because I don't need to. I don't know why I feel so obligated to take my work phone and check my emails. There's nothing, I'm not working at that moment. I'm not on call right now. Why do I feel like I have to? So it's like, take the work phone at 6 o'clock, put it on silent. You don't need to use that. That is your time for your family. You've already been to work all day. And like, setting these little boundaries just gives you like a good work-life balance, and helps prevent the burnout that we all talk about. We're all in this. All of us are in these careers for like, it's a long marathon. We have, 30 plus years to do this. This isn't a sprint. We're not doing it for 10 years, burning out and then moving on to something else, So it was like, how to have sustainability in your career. And I personally love hearing, learning, engaging, learning about what books to read and like how to just keep pushing forward.
Jeff, I'm gonna throw the ball back to you because otherwise I will want to hog this whole interview with Nicole. So tag.
I so enjoy this. I'm having flashbacks to my wife. She was a CPA with Price Waterhouse, and they would have their tax season and their busy season. And back in the 90s, they weren't talking about work-life balance a whole lot, right? And so now I see it with students. I see it with residents. I see it with faculty. And I have a daughter coming up. She's going to dental school. So this is so fascinating to me because I could learn from some of those boundaries. I need to put my phone on silent at 8 o'clock or 6 o'clock. And so I think that it transcends a lot of things. So this is an outstanding discussion. I like kind of sitting back listening to you guys. So go for it.
Yeah, you know what? It applies to men too. That's the thing. And it doesn't matter what your profession is. You can set boundaries in everything you do in life, right? And one of the things I've also learned is like do things that bring you joy. And if like if the pathway that you're on isn't bringing you joy, it's time to change, and that's okay. I had a really hard time when I was a resident to think and find that's acceptable because, some of the things I was told that, wasn't acceptable to do certain things and I had to, act a certain way or, God forbid, have a baby. Right. And now it's encouraged, right? And it's like, I celebrate. Somebody tells me that they're having a baby, like, great. What can I do to support you? How can I make, your role better? How can we make sure that you are going to succeed in your job and you're going to be an incredible mother, right? And it's just that kind of stuff that really does go a long way. But definitely finding joy, that was one of my things this year. Do things that find you joy, and it really does make, your job so much more fulfilling. Say no to the things that don't bring you joy, and do it intentionally, and set your boundaries, right? Say no to the things you don't want to do. You don't have to do it if you don't want to.
And, I love this too, Nicole, because I think the other thing that sometimes is just really comforting or validating is to just normalize the conversation. You had said, it's okay if you change. And I remember being so resistant to the idea that my life was going to change. And that brought a whole different level of stress in a way that was really kind of unnecessary. But without having someone to bounce some of those ideas or feelings off of, without that kind of, there's some things you just can't talk to. I was the only female in the first job that I had in our group. And you don't want to be a stereotype, and you want to represent and present the way that everyone expects you to. But a lot of the stress was also a little bit self-induced because you hold yourself to an expectation that maybe your colleagues aren't, but because they don't have any other default mode, they will, because that's how you present yourself. But it doesn't mean that it has to always be a certain way. And so I like that you highlighted that, because just normalizing the conversation sometimes helps you just not feel alone in those situations. Like, when I had a baby, it was really hard. Like, nobody said that to me. Like, nobody had talked about the you don't know how you're going to respond to those situations, but it was a very hard, like, I remember a very wonderful human had said, "Oh, I hope you enjoyed your vacation," when I came back from maternity leave. And like, my head almost spun around on a stick, right? Which, for, all of the things, right? But I was like, I would rather be dealing with a polytrauma patient crashing in the ER than go back to maternity leave. Thank you very much. Like, it was all of the things that nobody was talking about. And it wasn't that I didn't love my baby. It was hard. I was an older mom. It was a very different experience. And so having a place to talk about those things with someone is helpful,
Yeah.
So I appreciated that when you had said, things can change and it's okay. And having people to talk to is helpful there. And so as we kind of bring this conversation into kind of, if you were looking back at your younger self, right, what were some things that you wish you would have known, or advice you would tell yourself about being a woman in medicine?
Oh, so many. Honestly, there are so many things. And really, I just want to say it's okay to be yourself.
Yeah.
Because I always felt like I had to fit some mold. I had to conform to how everyone else presented, how everyone else dressed, how they spoke. And sometimes I didn't really feel authentically me. But why was that? Because, like the best version of yourself is authentically you. And that's when you do the best work. And that's when people see, that you have a personality and you can be charismatic and you can still do an incredible job. And so that really hits home for me because it was so almost robotic, like back in the day.
Yeah.
And I wasn't really allowed to ever really show emotion. And I'm sure we have all felt that. Like, you can go home and cry, but you're not going to be crying in front of an attending, right? You are tough as nails. and it's okay to be emotional, and it's okay to have feelings and feel a certain way and maybe express it sometimes. Maybe you don't want to do something that they're telling you that you should do for work, or maybe you need to set a boundary, and that's okay to do that. And I wish I would have been accepting of that. And then back to just the whole pregnancy thing. I was pregnant. I found out I was pregnant halfway through my third year residency. And I had to hide that. And I hid it for a very long time. I still did the ortho-oncology cases, and I was still holding my bladder for 7 hours when it was I'm not going to break scrub for this. So many little things. And I was just when I did finally tell a few people, in my director, he was, congratulations. And I'm oh my God, it was a weight was off my chest. Why did I have to feel ashamed of that? Right. And it was all self-induced. I came up with these things in my mind, but it was also the stereotype that went along with it. So I really didn't know how it would be perceived. So those are the small things that if I went back, my older self, be happy. You're creating a family. You're bringing life into this world. And you're still going to show, I have 2 daughters, how incredible it is now that I am I do all of these things. And I hope that I am a role model for them one day. And that was another reason for the starting the course, right? Because I don't want my daughters to ever have to go through some of the things I did. And I want them to, feel every female is a doctor. I'll tell you a funny story. So I was running back in the day. I don't run as much now. And my daughters would always ride their bikes with me. We were going by this small hospital where I live, and there was a lady walking in scrubs, and she was in a maroon scrub. And she was just walking on her break. And I can tell people always do laps around the hospital. And we were running by, and she goes, "Mom, what type of doctor do you think she is?" And, I just thought it was amazing that I've already instilled that, she's, not an MP, and she's not a PA, and she's not a nurse. She's in scrubs, and she's probably a doctor. And I was I honestly couldn't hide my emotion. And I had to pause for a second, and I was I don't know. I mean, maybe she's an anesthesiologist. She's I don't know, Mom. What color of scrubs do you think that they wear those color? And I'm oh, you can wear whatever color you want these days, express yourself, right? And how cool is that? My daughters think that, it's not the stereotype of a woman in scrubs is a nurse. Yeah. So, right. I mean, that is a stereotype. Even
absolutely.
When I, even now they're "Oh, so is my surgeon coming in?" I'm "Yeah, I'm here."
Yeah. I just explained to this, very complex surgery to you, and they're "Great, when's my doctor coming?" Yeah. I am your doctor. That's why I just explained this to you. Yeah.
So I thought that was so awesome for my daughters to kind of show me what I've been showing them for, the past 10 years. And for her to say that, I still to this day, I wrote that down in my journal, and I was I'm going to tell her that one day. I'm just so proud of her. And she didn't see the stereotype, and she didn't see, the stuff that, maybe I was, more pervy to, or how I used to view things, right? And that's so cool.
I love that.
What's interesting is The demographics of our profession have changed.
Oh.
I mean, even in the last 10 years, over half of our class is female. And, both of you in school and things, it's hard to find role models because on one hand, you want to be yourself. You want to be your authentic self. On the other hand, you need a role model to show you the way a little bit. So it's kind of a double-edged sword. But I'm so happy for our students today because our faculty is incredible. Dr. Richey, Dr. Toms, Dr. Violin, Dr. Kraleski, I can go on and on. Our students have lots of role models and the future is bright for them. And they're not going to have that same feeling about trying to hide their pregnancy, hopefully.
Right, 100%. And you know what? How nice is it to have such incredible staff like that? I mean, Joe, you're such a rock star, and the fact that they get to learn from you. I mean, I see her. When she asked me to join AO, I was like, oh my God, I'm so honored. Thank you. Coming from her, and then I'm sure they'll all keep in touch with you. A lot of the female students, and like you said, it's almost 50-50. What is it? It's like
it's
close, but
it's 2 years ago there were more females than males.
Okay,
and so it's right on that 50-50. Right.
Which is incredible to see. It was never all like that. So.
Oh, no. I mean, in my classes in, early 90s, I think, it was 90-10 percentage wise, or 85-15 or something.
Yeah. Excellent. So it's all positive.
It is all positive. So I have a question for you, Nicole.
Sure.
I admire your go for it nature. I mean, going to Paragon 28 and say, hey, I got this idea, let's make it happen. That's hard to do. And so I give you credit for that. Were you always like that? We've always been a go-getter?
I think it really was instilled in me to put myself out there. Because I always sort of wanted to break the narrative. It's always been in the back of my head. And again, my old director was always pushing me to get involved and do things. And at first I was like, well, go to these journal clubs and they're all there's a lot of males. And maybe I thought at first I was going to do a wine club, which I like red wine, and we could make it educational, and we could do a virtual wine club where you're doing journals, have your glass of wine, and the women in the area could do it. So that was my initial thought. But I'm we could make it bigger than this. And to have the support of Paragon to say, yeah, absolutely, you can come and do this and use our facility. I mean, that just goes to show what an incredible company, right?
Absolutely. It's so fun to watch too. I mean, all these companies are reaching out and giving back so much to our profession, and got to give them credit.
Yeah, absolutely. Joe?
Yeah, there's so many things, and we could just stay on this one topic for an entire episode. I guess the only other question that I'll have before we move a little bit off of that topic of women in leadership, what would you say to a student maybe who is struggling or I hate the word struggling because it implies some judgment there, but is feeling challenged in a situation perhaps? What would you tell them to help navigate some of that gender bias? Advice.
So when people are struggling and they feel isolated, my biggest advice is to ask for help, because a lot of times it's hard to ask for help, but people are there to support you. They're there to be for you. They're there, to bring you back up. You're usually not alone in this situation. And really, I've even had that struggle, even recently. And I know that I would give that advice to someone else. And so telling a student to ask for help, maybe it's one of their faculty at school that can help them. Maybe it's someone they met along the course of their journey that can help them. Maybe it's just somebody in another subspecialty that they became kind of close with, or maybe it's just a friend. And so that would probably be my best advice, is that if you're feeling isolated and alone, you feel, you're having these pressures, it's okay to ask for help, express yourself, and you will be shocked how many people really either have been there themselves and are willing to help you.
Yeah, I think that's brilliant advice. And, it's not just narrowed to women. So certainly you and I not having maybe as many female mentors, I had so many incredible men that were allies to help support me in my career. And while it's wonderful to have more opportunities to have female mentorship, I don't want to ever downplay the importance of exactly what you said. Find your network, people say, find your tribe, right? Like find the people that will help lift you and support you. And they could be male or female or
Absolutely.
They're asking for help is definitely, I'll switch to I language. This was something that I absolutely struggled with because you feel like you can do it all. Like, oh, I don't want to bother them. I can do this. I can, put on my big girl pants and get out there and crush it. And I don't need anyone to help me. And certainly in the biggest peak challenges of my life, that was where I went wrong. And so I love that you had said that as well, because again, it just mirrors this idea of, the more we talk to each other about what we think is helpful, the more we can be like, oh yeah, just like you said in the audience, like, oh yeah, been there. Yep, me too.
Yeah.
And that really helps.
Yeah. It helps reinforce that it's okay. What you're going through. And again, there are lots of mentors. And I do, which is amazing how many of my male colleagues love that I do a women's course and they're so supportive of it. And a lot of, even some of my friends nationally now are like, let me know when you're doing it. I'm going to post on Instagram and help, market this for you.
Yeah.
And I have a few great male colleagues that do that all the time. And I just love to see it. So it's a huge community and it's not male or female. And so it's grown in that aspect too, which is awesome, right? That's all we wish for.
Yep. Community of support.
Yep, 100%.
Are we okay if I switch gears or go ahead?
I was going to shift gears too. Do you mind if I ask a quick question about research?
Yeah.
So merging two programs is difficult in and of itself, but you start having 10 residents, everybody's going in different directions every day. Yeah. You're charged with kind of organizing and keeping the reins on the research. How do you do that? It's not easy. I mean,
that's not. And that's been something I've been trying to navigate. So usually I have our faculty send in cases that they would like someone to, possibly start a research project on. And then I keep a list that's a shared Google Doc with everybody so that they can keep an eye and they can tag their names to things that they might want to do and find interesting. And I don't want it to just be any research. I want it to be something that they actually are passionate about, right? Because not every resident has the same interests. And then what I do as part of my actual job is that I meet them all virtually every few months and we sit down and we say, all right, what is going to be your project for graduation? Where are you at? And so I make it so that the ball keeps rolling forward with them, because you do need residency is just so dynamic. There's so many moving parts. Sometimes research is the last thing, because you're just I'm trying to prep for this surgery and read the textbook and all these journals. And then there's me where are you at on your research? So I try to do the check-in. And so when we actually have one coming up in a few weeks where I sit down with each resident, 10 minutes. It's quick. I see where you're at, where you have you submitted to the IRB? What do you need help with? And then we kind of go from there. So the check-ins have been helpful to support them. And then the other thing is obviously topics come in and they just add them to the Google Drive, and assigning the residents I'm not assigning them, they're picking what they would like. But implementing this year, saying that in order to graduate, it's actually starting with the next class year, they have to have one research project completed in order to graduate. So it's just another layer, but then it also adds to the dynamic of the program itself.
That is so neat. And did you have them working together sometimes to kind of pass the baton down?
Oh, yeah. We do that a lot. Yeah. We did a huge, I'm a runner. And so we did a Detroit Free Press Marathon study, and it's still going. And, every year we collect the data from the marathon, and then we just sort of pass it from resident to resident. Then hopefully we're going to have a huge data collection over 10 years. And that's something that we can talk about, injuries and overuse and all those different things with lower biomechanics and long distance running.
I'm having a little PSD because I did the Detroit Free Press Marathon when I was a resident, and it was pouring rain and like 38 degrees, and we froze.
Yeah, it's hit or miss in October, but that's the only international marathon in the US, and you're going over the Ambassador Bridge and then through the Detroit Tunnel, and it's such a magical experience if you ever get the chance to do like a relay, or if you want to do the half or the full, it affords you to do the bridge in the tunnel, even for the half marathon. So that's awesome. Did you do the full?
Yeah, back in the day, and it was like another life ago, but I used to run a lot. And, but it was fun. I mean, we didn't run it very fast, but it was just neat to participate in the marathon. And it's beautiful along the river there. And like you said, you start over in Windsor and all that. Yeah. So it was outstanding.
I bring my residents now. We all have to do the medical tent, right? Since we're medical staff. So we actually just started 2 years ago when I took this role, like the foot and ankle tent. And let me tell you, we are one of the busiest tents. After the race, it's right at the finish line. You have a few of our core faculty and then whatever residents want to volunteer. It's a great CV builder. And if you're into sports medicine, those are the people that you want to see. And they all end up coming back to your office actually afterwards.
There you go.
Because they're like, I want to see that doctor from the medical tent. And so we've been doing that. We work the expo. It's great. It's a cool experience to have in Detroit.
Oh, for sure. How many people are running that marathon these days?
It's crazy, but I think it's around 19,000.
I thought it just kept growing. Yeah.
It's like 19 to 25,000. So like we send surveys out for the research, and like sometimes you only get like 9,000. And I'm like, I know there's more than that.
And then when all of them have 2 feet, most of them have 2 feet and 10 toes, there's a lot to go wrong, you know?
Yeah. And you need great data collection off those types of things. So
absolutely.
Yeah.
Oh, how fun. Sorry, Joe, I didn't mean to hijack the conversation.
No, that was great. Before we switch gears though, should we do a quick shout out to our sponsor?
Oh my gosh, let's do it. Bako Diagnostics. We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. Kudos to Bako. They've supported our profession at every level, from student to resident to practitioner. So they'll always love doing shout outs.
Especially in May, which is Melanoma Awareness Month.
Yes, indeed.
Getting the message out there again to encourage anyone listening, if you have suspicious lesions, to have them checked. And as a physician, to have a very low threshold to biopsy, because having had family members that have had melanoma, it's the kind of thing that you can save someone's life with something very simple. So, but to transition now, you've also been a big champion for ergonomics in the OR. Nicole, could you talk a little bit about kind of where that came from and some of the important things that we do to our body and maybe how we could protect ourselves better?
Sure. So for, our entire careers, or where I trained at least, we always stood at the foot of the bed, right? Bending over and kind of looking down and lifting like these heavy limbs as a resident, it felt like hours at a time sometimes. And over time, it was like wear and tear. And I ended up having to have I would say, I think it's been, I haven't really thought about this in a while, but it's been, I think, 6 years. And I actually underwent an ACDF surgery for a 1-level fusion of my cervical spine. And so that was a huge challenge in itself. So I was sort of like in the first 5 years of my career. Well, yeah, I would say 5 years of my career at the time. And of course, I'm a lover of running. And I ran in college. So this is like where all this running stuff comes from. And I was training for the Detroit Marathon. And I woke up one morning and like my right arm my shoulder had gone pretty much numb. And so, you shake things off and you go to work, and it turns out I had an incredible ortho spine colleague working with me that day. Like, it's a blessing in disguise. But he was like, why can't you turn to like your right? And I was like, I don't know. And I'm like, I feel frozen. I think I have a frozen shoulder. And he's like, I ran 8 miles this morning before work. He's like, what? I'm like, yeah. So he was like, come in the exam room, did like a quick physical. And he's like, something's up. I think you should definitely go get a quick like cervical x-ray. And he's like, you're too young to be like presenting like this. You should get an MRI. And of course, it turns out I did have a spontaneous rupture of my vertebrae. Nice. And, that's shocking. I was young. I just had my second baby. And, in the middle of training for this marathon, you put hours and hours of work. And, Jeff, like it is a time commitment in itself. And like, it was 2 weeks away. So like my first thought was like, what am I not? What do you mean? I can't run the marathon? I'm definitely going to finish the marathon and then I'll get this looked at.
Such a runner mentality.
The spine surgeon goes, so you need to go get yourself that MRI and I'll see you in the OR like in 3 or 4 days. So you don't, go paralyzed. And at the time I was like, oh my gosh, this is so serious. Like, how did this even happen? I have no injury. It was just wear and tear. I think it might've been like my positioning in the OR, strain on my neck, lifting, being in the wrong position. And like these kinds of like freak things do happen. And so since that day, like moving forward, I am back to like good health, but it's a humbling experience to be in PT 4 to 6 weeks after you had a spinal fusion. And I'm like, I need to strengthen this entire section of my body. And my therapist was like, he was the head of PT and him and I are really good friends now. And I said, you have to teach me how to sit and operate again. And he was like, that's what he asked me. What's your goal? I'm like, to get in the OR, like in maybe 2 or 3 weeks. I have like some cases coming up. He was like, I've never done PT on somebody with a cervical fusion, never this early. You're still in your like a C collar and you just want to learn how to sit and move your arms. And really it was humbling. It taught me patience. It taught me some resilience. It taught me to slow down a little bit. And, I had to sit there and work with him on rebuilding. We used like tools and different things. And I sat and faced the foot and, your muscle memory, we are so just like, it's just so ingrained in us, right? Yeah. You don't realize that as a surgeon, like your muscle memory gets you through so many things, how you're holding things, how you're making your incision, you're suturing usually, in a certain fashion and in a certain order, and everything like within a blink of an eye switched for me. So I took like a whole 1.5 years to like really slow down, relearn the way I'm doing things if I wanted to continue like in my career and in the path I was, taking on at the institution that I was, and still try to be as heavily surgical as I was before. And so I've slowed down on and been a little bit more, the best thing is having great partners, right? All of those cases were covered. I knew they were in good hands. Now, if there's something that is going to take me a long time, or I know that like that's going to strain me too much, my partners are so incredible. They're like, I'll come in there with you if you need me to do like a certain part. The residents are incredible. That's the best part of having them because they're really hands-on. If it's something that I want to send to my colleagues, I do, and there's no shame in that. That's another thing. If you felt like I had to do it, I might have to prove myself and I have to take on these huge cases. And nowadays I just pick and choose whatever is going to keep me again in like the marathon setting of our careers. So I can do this for like the next 2 decades. Longer than I've already done. Right. And so, I now take all the positives out of, such a crazy situation. And I teach the residents, when you're with me, I'm going to show you how you can do this without bending over. You're going to all do this and you're going to learn this. And when you get out and you're an attending, you can do whatever which way you want to, but I want to at least give you the tools and the knowledge to be able to do this a different way than you might be taught by the rest of our faculty. And so I honestly like, why didn't I do this from the beginning? Right? Why are we all taught to do things? And you know what? The more I talk to some people and networking at AO, and we talk about different the ways that we do things. So many surgeons, a few out a little bit further in practice, all tell me that they sit. And I was like, oh, okay. And they're like, yeah, I mean, if you can figure it out sitting, you can do it for a lot longer to less strain and prevent further injury, right? Because that's really what you're trying to do at this point. And I mean, at this point, I'm back to pretty much 100% doing anything I want to do from a seated position. And I relearned it over the past 6 years.
You can see why I think she's amazing, right, Jeff? Like,
oh my gosh. Yeah. I was going to say, that's a whole course, and it's a part of the curriculum in and of itself.
It really is. And there's so many things that you just have to retrain, which is just so crazy, because at first you're like, oh, this is going to be easy. I'm just going to sit and operate. Then I'm like, oh, wait, no. So many factors go into play when you're doing it from the opposite side, maybe using the opposite hand. And anything, it made me a better surgeon probably, because I could probably do it every which way at this point.
Upside down and backwards. And yeah.
So that's like a little part of my journey that, I'm glad you brought it up, because it has changed a little bit of the ways that I teach. And I think that if I can prevent injury in the future by just sharing that, and like maybe I think a lot of people are actually doing it now, but sometimes I've told you the story, and people have said like, oh, I've never even heard of like sitting and relearning. Oh my gosh, that must have taken a long time. And I'm like, yeah, you have a lot of patience to relearn something you thought you were like mastering at that point in your career, and you're relearning it again, just from a different, perspective, basically.
Yeah. Yeah. And, I think that's one of those situations too. There are so many places where our bodies can have different plans for us at different phases of life. And the more I talk to other surgeons, the more, do you know how many surgeons have spine issues? Like I was actually at a conference with a bunch of spine surgeons, and they're all talking about all their spine issues. And it's because, to your point, Nicole, we're all doing this, right? Like the people that are on the podcast listening can't see it, but they know the positioning, right? And so I thought your story was remarkable, and I appreciate you sharing it with us and our audience.
I remember.
Go ahead.
Oh, sorry. No, I just like that to that topic. I was at something in Michigan, and Mark Meyerson was speaking. And of course I had my call wrong because I couldn't like miss, the whatever the residents were going to. And I should come in, and he's like, what's going on with you? And I told him the story, and he like turns around, shows me the back of his neck, and he has like this long incision. And then he's like, I have a picture of this on my phone. And he had like the posterior fusion. He shows me the whole thing, and he's like, been there. And then I was like, I just want to know that I can go back to running and cycling and doing the stuff I love to do again. And he literally, in the middle of the conference, mid-lecture, as we're having like this side conversation, he goes and he does a headstand for the audience. Yes. And he goes, look what I can do. I've been practicing yoga for 30 years since this fusion, and I'm perfectly fine. And you know what? I just really needed to see that in that moment. I was like, yeah, okay.
Yeah. Well, we are getting near the end of time. I don't want to not have the chance to do some rapid fire. So I'll save some of my other things, and maybe we'll have you on for some other fun panel of discussions.
Yeah, but we could talk for hours, right? I mean, I'm with you. We'll get you back on the show too. Go ahead, Joe, start rapid fire.
All right. So you talked about books. Yes. What are some of the top 2 most influential books in your life?
Well, before I took the APD job, I read the book Between Grit and Grace. And if you haven't read that book, it is incredible. It taught me how to navigate some of like these hot topics and these different like situations I was encountering. And it also gave me the confidence to like go in and like own the interview, what am I nervous for? They're asking me to interview for this, right? I should be here for a reason. So that is one of, that definitely is my top book. My second one is sort of a toss up, but.
You can just do one if you want.
Yeah,
it's up to you.
Because I have a few, but they're just like, that's the one I always like recite and give quotes to, especially if I'm like, I just remember so many things. I've highlighted it and like I go back even like to this day, if I feel like I want like a little refresher, that book is incredible.
Awesome.
So Nicole, you're going to go for an hour run. What in your mind is the perfect setting for that 6 or 7 mile run?
Number one, I like to have a podcast going. I went from music to podcasts, and I like to listen and like really get into like what the podcast is to sort of take me off my mileage. And you know what's crazy? I really like running when it's just like spitting out. And I put a hat on, so it's like not pounding me in the face when I'm running. And I do like find it so refreshing, and it's like such mental clarity for me. So I like the podcast. I know it's crazy, but I like a little bit of raindrops. And I don't like it to be perfectly sunny. It doesn't need to be picture perfect by any means. And I just feel like I feel so refreshed, and I come back and like, those are the runs that I'm like, you know what? I think I got a lot done, like between here and here. It was just like a time for me to reset. And on a long run, that's what I do. And like usually on the podcast, I can go, oh, the other thing is I'm in a book club with the ladies on my street. And I never have time to sit down and really read the books nowadays. So if the podcasts aren't and they're doing their monthly book club, and I love it because it's just like all different genres, I will put the audiobooks on and like literally listen to as many chapters as I possibly can throughout that. And now I don't run as much because, trying to like sustain my
modifiable risk factors.
I have 2 things. And so I Peloton, or I just like cycle. Like I love outdoor cycling too. And if I'm Pelotoning, I don't even like usually put it on. I still do like the audiobooks or the podcast, and I can do that just as long. And I know I don't get like the environmental settings, if you're indoors cycling, but if I can be outside, it's like the same thing. Obviously, like for running or for cycling, I don't need to be in the rain, but yeah, like that. Those are my big things that make like a successful run for me.
That's awesome. Thank you.
That is awesome. Well, I could ask you a bunch more, but we'll save those for part 2 as well.
Perfect.
Sounds good. Nicole, thank you so much for carving out time for this interview. When I was looking at your CV, I thought, wow, you've done a lot for you and young in your career. And I congratulate you for that. And I congratulate you for giving back to the profession and training the next generation. We need more Nicoles.
Yeah.
Well,
Definitely.
Thank you, Jeff and Joe. Like, it's so nice. And honestly, I was like honored when you asked me to do this. I was like, yeah, I would love to. And it's just nice to like share my journey. And even if it's just a little tad like snippet of it, if I can like encourage and help and let anybody in the audience reach out anytime. I'm always available, except after like 6 p.m. where I'm not checking my work emails. Feel free to reach out anytime.
Thank you so much. And to all of our listeners out there, if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. You'll be able to listen to your own podcast when you're out for a run, Nicole.
Oh, I might have to do that. I don't know. I don't know if that's going to be enjoyable to hear your own voice.
I think you'll enjoy it because it's funny because, you go through an hour of talking and you kind of like, oh, yeah, I forgot we talked about that. So it's kind of fun. And then if you're listening on or watching on YouTube, please become a subscriber. And Nicole, we're going to send you a Dean's Chat cup. We've got these little mugs.
Awesome.
I don't know what your drink is of choice before a workout, but you go for it. And
no black coffee.
Well, that's perfect. A little free fatty acid release. I got it. All right. Well, cheers, everybody. See you next week.
Cheers.
Cheers.